At CSUN, what I'll do is I go there once a week during the school year, and the family practice doctors are seeing patients all week long. So if they have a complex gynecology problem, in other words, somebody's having a problem and they use the standard treatments for it, and actually I've given them a protocol for the standard treatments. In other words, I say this is the best way to handle this, this is the best way to handle this, because it works most of the time. Every once in a while it won't work. So they save those patients up for Thursdays when I go, and I see all of those complex problems on Thursdays. I have a 24-year-old girl walk in that's never had a period. Okay, maybe no breast development. Okay, maybe no axillary hair. A number of different things can cause that. Clearly at 24 years old, she should have had a period. She should have gone through puberty. And I've seen girls from CSUN that have never even gone through puberty. So it can be a genetic problem, it can be an ovarian problem, it can be a uterine problem. Well, it's my job to figure that out. So ultimately we find out the problem, we put her through puberty with hormones, and you know, depending on what the cause was, a lot of times we get them totally back to normal. Girls that have taken birth control pills for 8 years, miserable on the pills for whatever reason. Again, most young women are fine on the pill. There are some women that just can't handle them. Yet alternate contraception is not good for them either. So I know every single pill. I know the hormonal component of every single pill. I know what is probably causing the problem, and we switch to something that won't cause the problem. You've got women that are focused on their careers. They've got education to get out of the way, and then career establishment to get out of the way, and everything else to get out of the way. And of course, that biological clock is ticking, and it doesn't really dawn on people oftentimes until it's too late. I mean, classically, I'll have a 42-year-old woman walk in here who's professionally very successful, head of a network, and say, okay, I want to try to have a baby, and I've been trying for 2 years now, and nothing's happening. Well, at 42 years old, those poor eggs are in big trouble. All right? So wouldn't it be nice if we could take those same eggs at 22 while she's a college student and freeze them, and then when she's 42, use those eggs, which gives her the fertility of a 22-year-old instead of 42-year-old. The younger the egg, the better as far as surviving freezing. So we get calls here in the center from women diagnosed with horrible things, breast cancer at age 22 or 23, uterine cancer, cervical cancer. So they're going to have to go through radiation and chemotherapy, and their ovaries are going to be wiped out. So we get them in here, we get those eggs out and freeze them. Then they can go through, conquer their cancer, come back 10 years later if they like, and their eggs are just fine. Young women that store when they're in college pretty much have stopped the biological clock. Most major fertility centers advertise in local university newspapers because there you find bright, educated women that are young and fertile, and that's who you're after. So we place ads, and we specify, you know, you've got to be between 18 and 27 years old, you've got to be drug, alcohol, and tobacco free, disease free, no genetic diseases in the family, and we get calls. And as we get the calls, we bring the women in, we screen them on the telephone, and if everything sounds okay, we bring them in. We end up accepting about 2 out of 5, about 40%. We reject about 60%, because even though they think they're totally fine, we do a lot of blood testing on them and a lot of sophisticated studies, and they're totally fine for themselves, but they're not fine enough to be a donor. Okay? Not uncommon to have somebody walk in and have a positive alcohol screen, and we tell them we're going to screen you for alcohol, don't drink. They drink, oh, I drank 3 days ago. Well, our screens are very, very sensitive. So we pick up the alcohol from the weekend before, and they're out. All right? It doesn't mean that having alcohol means you can't have a baby, but I have a hard time convincing a couple that needs that egg that they should use it in somebody that's drinking on the weekends. We do drug screening, and again, we get, you know, positive drug screens, and we warn them. We say, listen, if you're using drugs or you used it any time in the last 6 months, we're going to pick it up, and lo and behold, we do. The good thing is that 40 to 50% of the time they're totally, totally fine. Everything works out great, and we accept them as an egg donor. So we get in the dozens, not in the hundreds. We get in the dozens. We run it every school year. And we get about 1/3 the number that we get from UCLA. So UCLA, of course, is a bigger school. We get a lot from UCLA. We get a fair number from CSUN. Cal State LA, we get a lot. UC San Diego, we seem to get quite a few. USC, not quite as many. Cal Lutheran University, get a lot of calls from Cal Lutheran. UC Santa Barbara. So we get calls. It involves taking injectable medications for 3 weeks, so it's an injection every day for 21 days, sometimes 25 days. It's a subcutaneous kind of injection, like a diabetic injection. Little children take diabetic insulin injections. So it's the tiniest little needle that there is. And, you know, everybody's scared when they come in and they don't want to do it. But we have great nurses, and they teach them how to do it. They practice on an orange, and they can actually give themselves the injections. So they take the injections, and the first thing that the injection does is it shuts off the ovaries. We turn their ovaries off temporarily. So as long as they take the injection, their ovaries are sound asleep. We do that same thing to the woman that's going to get the eggs. We turn her cycle off. And that's how I synchronize cycles. Because once both women's ovaries are turned off and they've had their period, they're at the exact same spot in their cycle. Okay? Once they're at the exact same spot, then we give the egg donor fertility drugs. We wake her ovaries up, but not at the normal level, at a much higher level than normal. So instead of making 1 egg, she makes 10 eggs. So as she starts to make her eggs, we give the recipient, the person that's going to get the eggs, estrogen, so that her uterus, not her ovaries, we keep her ovaries asleep because they're older eggs and they're not going to make a baby anyway. We want her uterus to prepare to receive the eggs from the donor. So the donor's taking fertility drugs, her eggs are growing, and the recipient's taking estrogen, and her lining, her uterus, is getting ready to receive the embryos. It takes about 2 weeks to get that done. So it's injections for 2 weeks. They come in 3 or 4 times over 2 weeks. Each time the donor comes in, her eggs are bigger and bigger and bigger, and her estrogen is higher and higher and higher. And we're keeping the recipient, because they don't meet each other, it's anonymous, doing the same thing with her uterus. Finally, the donor's ready. Okay, we take the eggs out through the vagina. It's a surgery, it's a minor surgery. We sedate them heavily. We put an IV in, and we give them a combination of something from the morphine family and something from the Valium family. So they're awake, and you know, they'll talk to us, but they don't care about anything. Okay, it takes about 20 minutes when we get the eggs out. There's no incisions, it's all done with a tiny needle through the vagina, and we've got a test tube filled with eggs. And they're pretty much done. We give them a check for $6,000, and we ask them to come back in a week and report any problems. The complication rate is extraordinarily low. Once we have those eggs, of course, we take the sperm from the family, the parents, and fertilize the eggs. We produce the embryos, and 5 days later, mom, whose uterus we've been preparing, receives the embryos. Pregnancy rates are about 78%. 3 out of 4 chance she'll get pregnant the very first time, which is very, very high. And legally in California, the parents don't meet the donor doesn't meet the parents, they know nothing about each other, and the parents that receive the eggs are the legal parents. So their names go on the birth certificate, they take their baby home, and the donor's done a great job and made a couple very, very happy.